This is Arise America.
Now, no matter where you go in the world, people face challenges with mental health. Well, when COVID hit, many were adversely impacted, especially children and teens. It's not that this population didn't have challenges with their well-being before, it's just that with the increased isolation and overuse of social media, the problem grew. So now, a national crisis in the US has been declared. The Center for Disease Control reports an uptick in tics, anxiety and depression in adolescents. The chairman of the Psychiatry and Behavioral Health Department at Lurie Children's Hospital of Chicago, John T. Walkup, says the biggest misconception is that COVID makes people mentally ill. From my point of view, well, COVID unmasked people who have underlying vulnerabilities. So what's been done to address this crisis for the nation's most vulnerable population?
Brains and harm.
Mental health and learning disorders are the most common illnesses of childhood and adolescence. 1 out of 5 young people struggle with disorders like depression, dyslexia, ADHD, OCD, eating disorders, and anxiety. I was one of them. As a child, I struggled with crippling anxiety, the most common and least recognized childhood mental health disorder. The mental health crisis in America is really a children's mental health crisis. Every year, over 1 million young people visit the ER because of suicidal ideation and suicide attempts. 5,000 die by suicide. When we ignore mental health, we lose our children. We have the tools to stem this crisis if we're willing. The Child Mind Institute is the leader in the field. It's the place where kids are getting better and the place that is doing the research and developing the programs that will change the landscape of children's mental health. Give today at childmind.org.
That's the American actress Emma Stone for the Child Mind Institute. Well, 2 years ago, those were her words still ringing. And do they ring true for today? Well, for more on this crisis among America's children, let's bring in mental health advocate and psychotherapist Dr. Ngozi Okose, who joins us from Texas. Good to have you on the show, Dr. Ngozi. Now, between 2016 and 2020, studies have shown about 29% increase in youths with anxiety and 27% increase in the same category suffering from depression. What do you make of these statistics and how troubling is this?
It's really a troubling situation. The statistics is even more staggering at this point. New data released by Center for Disease Control and Prevention found that like 37% of all high schoolers reported experiencing poor mental health during the pandemic, and with 44 reported persistently feeling sad and hopeless in the past year. So it's getting worse, and the pandemic has actually made it worse because pandemic has taken a toll on not just the children, on the adults who care for them. Many of them experienced a lot of loss of jobs, a lot of family members, and loss of social activities and sense of security. And with that loss, the mental health of the adults who care for these children are also challenged. So it's brought, the Center for Disease actually identified that the highest reason for this increase in mental health is based on abuse. Many children reported abuse, physical abuse, emotional abuse, and verbal abuse. So it's made the condition worse for this vulnerable population. And it's a pandemic on its own.
We've been seeing the numbers rise higher mostly during the pandemic. To what extent do you think the pandemic affects the mental health of young people?
Oh, it does to a great extent because their way of life was seriously disrupted. Schools were closed. They were locked in, pretty much locked in. Kids were kind of locked in and stuck with some family members who they themselves didn't know how to handle their own mental health situation during the pandemic. So it really affected them. The adults had heightened anxiety, heightened panic, increased depression, and then that consequently affect the children who couldn't process the crisis. They could not process the crisis. The schools were closed, their friends were shut out from them, and they are confused, they were angry, they were restless, they didn't know what to do. and the adults around them didn't know how to handle them. So it's going to get worse, actually. What we're experiencing when the pandemic started, we're experiencing sense of loss of job or security, but the impact of pandemic will last for a very long time, especially from the psychological realm.
Well, beyond the impact of the pandemic, what could be the major reasons for the spike in the number of mental breakdown among children in the US?
So sometimes it's so difficult, but I think stress is a major reason for mental health problem overall. And there's an increase in stress. There's in the Western world, not just in the US, there's this high expectation and of people that many people cannot cope sometimes, and it begins to affect them in a very, very negative manner. And sometimes mental health could be rooted in so many things. It could be based on drug addiction. Some of these children start taking drugs. It could also be rooted in use of internet. Some of them, all they do is just watch the social media. So, or watch certain things that does not enhance their mental well-being, but actually impacts it in a negative manner. So there are so many reasons that could, there's never one reason why mental illness spikes, but it's a factor of so many things, and it disrupts the life of so many people, even before the pandemic.
Dr. Ngozi, it gets worse with silence and parents not knowing on time, and it's hard to get help, particularly with the limited number of mental health professionals. What are some of the signs to look out for, and how best can they be helped?
Yeah, many signs to look out for. I would say, for starter, we'll look at the genetic predisposition of any member of our family to have problems with mental illness. Sometimes it stems from the chemistry, or maybe certain medical conditions, or substance use, like I said earlier, or grief, loss, because so many people lost a lot, so there's grief. But as we navigate, you find that mental illness is a condition without a face. It's an ailment without a voice. And many people tend not to talk about it. So the stigma associated with mental illness is huge in so many countries, especially here in the US, of course, especially in so many other Western world. So people go through rough times daily, and it's always good for parents to watch out for that time when the children don't feel like getting out of bed in the morning, when they don't sleep through the night, when they hide in the rooms, they don't want to come out from their rooms, when they don't want to go to school, when they cry, when they withdraw, when they become angry, when they get frustrated easily, when they show signs of anger, or they feel numb. Sometimes you're talking at them, they're just looking at you, and they can't sleep. So we need to watch out for those little signs from the children, so that, and some of them will even start engaging in maladaptive behavior. Some will be stealing, and then some will not care for themselves, and they are forgetful, they look confused. Their performance in school will start to go down. So we need to watch out for all this so that we can nip it at the bud and be able to provide the help that our children need.
Thank you for your brilliant take at this hour. Dr. Ngozi Okose, psychotherapist and mental health advocate in Texas.
This is Arise America.